Hi guys, today we're going to talk about Menkes disease. It is also known as Menkes syndrome or kinky hair disease. It is a rare genetic disorder that affects copper levels in the body. It is caused by mutations in the ATP7A gene, which is responsible for the copper transport and regulation of copper in the body. Okay, just a fun fact, the ATP7B gene is responsible for Wilson's disease, which is a excessive copper disease in the body. The key features of Menkes disease, there's copper deficiency. Menkes disease prevents the body from absorbing and distributing copper properly, leading to copper deficiency in key tissues like the brain and liver. Menkes disease is an X-linked recessive disorder. It's really important. This is an X-linked recessive disorder. It primarily affects males, though females can be carriers. So for females to get it, both parents would have to transfer like one defective gene to the female. The symptoms of Menkes disease. Symptoms typically appear during infancy, usually within the first few months of life. The early signs that a child will present with: hair abnormalities, sparse, brittle, or kinky hair, feeding difficulties, poor feeding and failure to thrive, hypotonia, low muscle tone, floppiness or weakness, seizures, which are often difficult to control. Developmental delays, significant delays in reaching developmental milestones such as sitting or crawling. There's intellectual disability, neurological symptoms, irritability or lethargy, progressive neurodegeneration, low body temperature. So now something that's really important is that the facial feature, distinctive appearance with pudgy cheeks and a high forehead. As we spoke about before as well, that the cause is a mutation in the ATP7A gene. This gene is critical for the transfer of copper within cells and its release into bloodstream. Mutations, they lead to a systemic copper deficiency. So in the diagnosis, clinical examination, you'll look for kinky hair and developmental delays. Laboratory testing, you'll see low copper and ceruloplasmin levels in the blood, as opposed to Wilson's, which is an ATP7B mutation. You'll see high copper and high ceruloplasmin levels in the blood. Genetic testing, identifying mutations in the ATP7A gene, and you can also do a microscopic examination which will show kinky hair. The treatment, although there is no definitive cure for Menkes disease, early treatment may improve outcomes. Copper histidine injections, providing copper directly, can help if started very early, ideally before symptoms progress. Effectiveness is limited and depends on the timing of treatment. Supportive care, nutritional support, example feeding tubes if necessary. Seizure management, physical therapy to address muscle tone and mobility issues. The prognosis of Menkes disease is often fatal in early childhood, typically by the age of 3 due to severe neurological and systemic complications. Early diagnosis and copper supplementation may extend life expectancy and improve quality of life, but the overall prognosis remains poor.